Thank you for joining us for this community briefing. Joining me once again is interpreter Margie Propp, and thank you so much, Margie, for providing your services to make this briefing more accessible. Before we update you on COVID-19 in our community, I want to take a moment to acknowledge the tragic death on one of our city buses yesterday. On behalf of the city, I wish to offer our sincerest condolences to the family of Sharon Johnson. Thanks to the professionalism and preparedness of StarTran and our Lincoln Police Department, we did have quick arrests made in this case. Those arrests are crucial to assuring the public that the suspects have been identified and apprehended. They're in custody, and this is also an important step in bringing about justice for the loved ones of Ms. Johnson. Once again, our hearts go out to Ms. Johnson's family and friends as they try to reconcile with the senselessness of this tragedy. Next, we'll begin our COVID-19 update. We encourage everyone, as always, to visit our website, covid19.lincoln.ne.gov, and there you will find a dashboard with the latest COVID-19 data. We update that dashboard at about 3 p.m. daily, and you will also find our risk dial there, a color-coded tool that provides the public with indicators on the level of risk of spread in Lincoln and Lancaster County. We update that dial every Friday, and for the last 2 weeks, we have been in the low orange range, indicating a high risk of the virus spreading in our community. This week, we are moving the dial to mid-orange, still in the high-risk level, but also an undesirable progression towards the red or severe risk level. Our indicators continue to move in the wrong direction, and it will take each and every one of us doing our part and doing what's right to reverse these trends. That means taking these precautions. Wear a mask every time you are outside the home around other people and in public places. Watch your distance and keep at least 6 feet between yourself and others at all times. And wash your hands frequently. Watch yourself for symptoms of illness and stay home if you do not feel well. Today in Lincoln, an additional 49 individuals have tested positive for COVID-19. The total number of lab-confirmed cases in Lincoln now stand at 2,718. On a more positive note, our total recoveries identified up to date are up from 939 to 1,008. Here today to describe and walk us through our main indicators that we use to determine the position on the COVID-19 risk dial is Health Director Pat Lopez.
Thank you, Mayor. As the local health department, it is our responsibility to guide the public on the actions that they can take to protect the public's health. Our department has decades of experience with investigating outbreaks of disease in our community, such as influenza, pertussis, STIs, and many foodborne illnesses. Our response to COVID-19 has been on a much larger scale and has involved many more people. The critical part of our response is our epidemiology team. These are highly trained individuals who deal with the incidence, distribution, and possible control of diseases. The team continually monitors the data and indicators that we consider when we determine the level of risk in our community. The COVID risk dial is a tool to help translate the data and the indicators into recommendations for the public on how to protect themselves, their families, and our community. We have developed specific guidance, not just for the general public, but for also for businesses, child cares, and schools. As the mayor said, we have taken another step back in its fight against COVID-19 and have moved the dial from low orange to mid-orange. The position of the risk dial is based on multiple local indicators and information from the previous 3 weeks. Today, we will again update you on 5 of the key indicators that we consider. The first key indicator is the number of the new COVID-19 cases. We look at this trend and also at the demographics. When averaged over the 7-day period, we have continued to see a trend in higher daily cases. Over the past 3 weeks, the 7-day rolling average has increased from 17 on June 17th to 47 on July 17th. As we've seen since the beginning of the pandemic, the number of daily cases can vary widely, and that number often depends on when results are reported. The trend, however, gives us a better indication of our local situation. We also see this trend in the graph that shows the number of weekly cases. For the last 4 weeks, our number of weekly cases went from 85 to 169 to 226, and then to 331 for the week ending July 18th. So far this week, we have 300 reported new cases. So we are on track to be at last week's total or higher. We are seeing 2 demographic changes in our case numbers. First, we recently reported a change related to the age of newly diagnosed individuals. And that increase in cases is in younger adults continues to be more pronounced. Since the beginning of July, 77% of the new cases have been under the age of 40. The 20 to 29 age group is of particular concern. This age group makes up only about 18.5% of our population. However, since the beginning of July, 53% of the new cases have been in this age group of 20 to 29-year-olds. The other demographic change we have seen is in race and ethnicity. Many of the new cases are among those under age 40 are in white individuals, and about 77% of the new cases are white, the highest percentage since late March. You'll recall that earlier in the pandemic, we saw specific clusters in the particular populations, communities, and work sites. The percentages now are more reflective of the makeup of the general population. The higher percentage of white residents is also evidence in the general spread in the community. A second factor we consider in setting the dial position is the positivity rate. The percentage of tests that are positive, the average weekly positivity rate for the last 3 weeks in June was 4.4%. Excuse me. The overall positivity rate looks at cases and tests since the beginning of the pandemic, and it too is on the rise, going from 6.4% on July 3rd to 6.8% today. Another key factor is testing. Here we look at both the capacity and the turnaround time for receiving test results. The capacity and availability of testing in Lincoln has not been an issue since early April. After averaging about 2,500 tests per week for many weeks, we saw an increase to about 3,000 tests completed the week ending July 11th. This past week, we saw another jump with just over 5,000 tests completed, the highest weekly total we've had. So far this week, 3,176 tests have been completed with 2 days to go. Since the beginning of the pandemic, almost 40,000 individuals have now been tested for COVID-19 in Lancaster County. This is an unduplicated number. The increase in testing is a good sign, and we are very fortunate that anyone in Lancaster County who needs to be and wants to be tested can do so. Bryan Health and CHI Health St. Elizabeth both have capacity to do more testing at their drive-through sites. To get started, you can fill out the free online risk assessment at chihealth.com or bryanhealth.com. Test Nebraska has expanded its testing to 6 days a week. That process starts at testnebraska.com. You do need to go through these websites to get appointments for testing. The testing turnaround time fluctuates from week to week, depending on the regional and national demand for testing. Unfortunately, when hotspots across the country do more testing, it can cause delays in receiving our lab results locally. This is an area we have no control over. but it is a factor in how timely we can follow up with people who have positive test results and begin the important contact tracing process. Our capacity and ability to do the contact tracing is a fourth key factor that we consider when determining the position of the risk dial. We currently have 34 contact tracers available to conduct a case investigation. This capacity is sufficient at this time and has kept pace with the demand. Nursing staff still initiate contact tracing and attempt to reach out to close contacts of positive cases within 24 hours of receiving our test results. However, as previously mentioned, we have seen slower turnaround times of receiving lab tests. Lab results are coming in slower in an average of 3 to 4 days for many labs, with one lab taking 3 to 15 days. The delay in getting results delays the start of the investigative process, and it does impact our ability to prevent the development or case clusters or outbreaks. Health department staff are thankful that most people are cooperating and being part of the solution in preventing additional exposures. When we reach the close contacts of people with the virus, we share information, answer questions, and provide referrals for testing, medical evaluation, and other services. The fifth key factor is evaluating the capacity of our hospitals and the strength of our entire healthcare system. We look at the number of patients hospitalized, the number that are COVID-19 positive, and the availability of ICU beds. Lincoln hospitals are in a great position. The percentage of available ICU beds is at about 55%, and the percentage of available ventilators is near 90%. The number of COVID-19 patients in our local hospitals today is down from 18 individuals yesterday to 15. That includes 11 Lancaster County residents and 4 from other communities. With an increase in the number of overall cases, however, we expect to see an increase in the number of patients needing hospitalization in 2 to 3 weeks. This is what other communities have experienced across the country. With our COVID-19 risk dial moving closer to the severe risk level, we are calling on everyone to please limit interactions with people outside of your own household. We should assume there is a high risk of exposure anytime we are out in the public with other people. Again, it appears that many young adults have resumed normal social behaviors of hanging out in groups, going to parties, and multiple bars. Our local situation is still far from normal, and these behaviors are contributing to the increased spread of COVID-19 in our community. Several downtown bars continue to be identified as possible places of exposure. The common factors mentioned by those who became ill were crowded conditions in those bars and not wearing a mask or facial covering. I urge young adults to consider the risks before you go out. If you do go out, wear face coverings. The behavior of some young people continues to be part of the problem in moving us in the wrong direction, and we need them to be part of the solution instead. Please be a hero and wear a mask.
Thank you, Director Lopez. Throughout this pandemic, our top priority has been to protect the health and safety of all of our residents, including healthcare workers and those on the front lines delivering essential services. Other important goals have been to mitigate the economic and social consequences of the pandemic and to communicate regularly and openly with all of you about the steps we need to take, not only to survive, but to thrive throughout this unprecedented health emergency. We enacted our local mask requirement on Monday because the data and evidence about this one new action are clear. Masks are one of the most effective tools we have for decreasing viral transmission and fatalities, along with physical distancing. If you look at infection rate trends in places with a high degree of COVID-19 transmission, infection rates often flatten only after face mask measures are enacted. One study estimated that mask requirements cut the growth rate of infection by 25%. This translates to a significant amount of lives saved. And here's another illustration that hits this point home. According to a recent CDC report, vigilant mask wearing likely spared 139 people who visited a hair salon from catching the coronavirus, even though they interacted with 2 hairstylists who later confirmed to have coronavirus during the time of those interactions at the salon. None of the 139 people ended up showing symptoms of COVID-19, and the CDC has concluded that adherence to face masks on the part of the stylists and customers likely prevented the spread. Emerging evidence suggests that wearing a mask may protect the mask wearer more than we previously realized. According to Dr. Joshua Sharfstein, an expert in health policy at the Johns Hopkins Bloomberg School of Public Health, a new paper suggests that wearing masks may help us protect ourselves from more serious illness. And this is because wearing a cloth face covering is estimated to screen out a significant percentage of virus particles, meaning that the mask wearer is exposed to and inhaling less virus. And that smaller exposure seems to correlate with milder cases of COVID-19. Given what we are learning about how masks may make the disease milder for people who wear them, and recognizing that the CDC director has asserted that mask wearing is one of the most important steps we can take to slow the pandemic, we continue to urge everyone in our community to embrace the practice of wearing masks. And we thank all of you who are embracing this important step in preventing the spread of the disease and protecting one another. The good news today is that we have received predominantly positive feedback from our public on this preventative measure and our new requirement. Additionally, our community's businesses are reporting that they are seeing an increase in the number of customers wearing masks. We're grateful for the head start that many businesses in Lincoln gave to this effort, as many had already implemented their own mask requirements. Our measure is helping to emphasize, support, and expand their efforts. We have received about 40 calls per day from businesses inquiring about the mask measure to ensure that they understand the mask requirement because they are eager to comply. We have not received many complaints, about 35 this week. Again, we are focusing on education and support as our primary means of enforcement. And as a reminder, we have information and resources about masks placed very prominently on our citycovid19.lincoln.ne.gov website page. One of the questions we continue to receive is what to do if someone is not wearing a mask in public. And our best advice and response to that question is simply to stay 6 feet away from that individual, wear your mask, and avoid interaction. You do not know if that person not wearing a mask falls into one of the categories of exceptions. Please do not call law enforcement emergency or non-emergency numbers. If you do feel compelled to act, if you suspect non-compliance, please register your concern through the Uplink phone app or the link on our city website. Businesses with specific questions about the mask requirement can also call the health department at 402-441-6280. Finally, we wish to remind everyone that the choices we make this weekend and next week are what will make a difference in preventing exposures and potential new cases in the coming weeks. Please do your part and take action to prevent further exposure in our community. The actions we are asking you to take are common sense precautions, small steps that make a big difference. They are simply those 3 W's: wear a mask, wash your hands, and watch your distance, keeping at least 6 feet from other people. To close out the briefing, we want to end the week with some positive news, especially for the class of 2020 and their families. Through a great deal of hard work with our health department, the Lincoln Public Schools has developed a safe way for our high school graduates to have an in-person graduation ceremony this year. A busy weekend at Pinnacle Bank Arena starts in about 2 hours with the Northeast High School graduation. There will be 3 ceremonies Saturday: Southwest High in the morning, East High in the early afternoon, and North Star in the evening. Then Sunday ceremonies will include Southeast High at noon, and on Sunday evening I will be joining other Lincoln High parents as we watch our children, our young adults, I should say, cross the stage and get their diplomas. The in-person attendance will be limited, but the ceremonies will be live streamed at lps.org and carried on the Link TV education channel and social media sites. We want to say congratulations to all of our 2020 graduates. And with that, we'll open up the briefing for questions from the media. Do we have questions from the media?
Mayor, this is Bill with 1011.
Hi, Bill.
Yeah, hi. I was curious if the health department was able to track down any more information on symptomatic versus asymptomatic cases and what we're seeing locally.
I'll ask Director Lopez to come up with your question then.
Hi, Bill. The number of asymptomatic cases that we've been in contact with has been relatively small, and I have to apologize, I didn't bring that number today. We have just started getting some reports on it, but our numbers are really small on asymptomatic cases.
And do you know how many hospitalizations are in that younger age group?
We're seeing primarily a younger age group, and I don't want to say that's in interacting with the hospitals, and we can certainly report on that on Tuesday. We'll know our ages. I'll make sure we do that for you.
Thank you.
Mm-hmm.
Any other questions today? All right, well, thank you so much for tuning in. We'll be back next week with more information about COVID-19 and how we all can take steps to protect ourselves, our loved ones, and our neighbors. Thank you so much for tuning in.